to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us now is Dr. Samuel Hoy, Medical Director at McLaren Bay Region Wound Care Center. Thank you so much for being here this morning. How are you, Doctor?
Hi, good morning. Thank you for having me.
Good morning.
I'm doing well. How are you?
I'm doing well. We're so excited to have you. We're delighted you're here. Today we are talking about wound care. And this is such an important topic, Doctor, because sometimes people have a wound and it just won't heal. So how does someone know when it's time to have your doctor check that out?
Absolutely. Excellent question. So exactly like you said, most wounds want to heal. There are certain wounds, if they don't heal, you have to see us. Why? Because they are proving to be difficult to heal and it needs some additional treatments or some additional attention. Particularly if your wound is 30 days or older, we want you to see us.
Yeah.
If there's a change in the wound, meaning it's red, it's draining, there's a foul odor to it, it may have some underlying infection, it's going to have a difficult time healing. And so those are really things that we want you guys to keep watch of, because those will have a difficult time and will definitely benefit from seeing a professional, whether it's your primary care or certainly us at the Wound Care Center.
Yeah, that's great information. Good tips there. Now, Doctor, are there some risk factors that may make it difficult for wounds to heal?
Yes, absolutely. So common ones are if the wound is because of an underlying health issue. It could be from poor nutrition. It could be due to medical conditions such as diabetes. Smoking actually really makes some wounds difficult to heal. Even skin dryness or having constant irritation to it. But certainly if there's even more concerning signs such as a lack of blood flow or an underlying infection, those make them very tenuous and certainly require medical attention.
Wow, didn't know that. Okay. Now, Doctor, we hear a lot about oxygen therapy. So what is hyperbaric oxygen therapy and how does that work when it comes to wound care?
Oh, that's an excellent question. One of the benefits of being at a wound care center is absolutely having an access to a hyperbaric oxygen chamber. And this chamber is designed to increase the amount of oxygen that is inhaled. So you actually go into a chamber and that chamber increases the atmospheric pressure of oxygen 2 to 3 times more than normal. So when you're in there, the person breathing that oxygen increases the amount of oxygen load that is brought over through the bloodstream to that area of the wound. And so this can't be performed at normal oxygen levels in the normal atmosphere. And so that's where the benefit of a hyperbaric chamber is. It's a very specific machine. Only certain places have it. It meets certain criteria for you to have it, but it's certainly a really good tool to have, and I feel very lucky that we have this in order to be able to provide that service to our area.
Yeah, Doctor, like you just talked about the hyperbaric oxygen there, how does patient care at the McLaren Bay Region Wound Care Center differ from just seeing your primary care doctor?
Absolutely. So I will always say, go to your primary care if there's any concern. That's your first step. They know you best. But one of the benefits of being at a wound care center, in addition to what we've already mentioned with the hyperbaric center, is that we've really created a strong, dedicated, very specialized team for you, which is really meant for just your wound. Wounds are becoming increasingly complex, and it requires someone to walk you through the entire process to get you set up from the time you enter our clinic from your home, getting you all the way back home with the appropriate supplies. But there's nurses, MAs, there's wound specialists, providers, and there's case managers that run all of this for you. And that's where we can get a really expedited type of care, and we can coordinate with other specialists who might need to see you. For example, if they could be blood vessel doctors, they could be dedicated foot doctors, they could be dedicated general surgeons or even plastic surgeons. And that's where the Wound Care Center coordinates all this for that particular patient with the wound.
And Doctor, there are so many people out there that do not have a doctor. How can someone find a doctor if they don't have one?
Absolutely. So number one, when it comes to the wound care center,
Yeah.
you can see us directly.
Okay.
We can be your first primary point of contact for a physician. But I do want you guys to be connected to a primary care. So certainly come to us directly and we can set you up. Or if you don't have one and you need to seek a primary doctor anyway, my recommendation is we've got a lot of providers and that can be easily accessed through even the internet at mclaren.org/Bay Region, and then click on Find a Doctor. That's mclaren.org/Bay Region and Find a Doctor, and we'll plug you right in.
What else would you like to say, doctor? If people are out there, they say they have this wound, they don't know what to do. Anything else? Any other tips that you'd like to give patients out there?
You know, I think the biggest thing is that we want to be a resource for the community.
Yes.
And the goal is to get you back to a point where life feels better.
Yes.
If you have pain, if you have a wound, we want to be able to treat you. So I just say, don't be afraid to come see us. I know wounds can be very cumbersome. You're not alone with that. That's all.
Doctor, thank you for being so compassionate and for breaking down this information and making it so easy for us to understand. We appreciate it. Thank you so much.
Of course.
And if you have any more information, just head on over to the Aging and Style page. That's at WNEM.com.